Hi everybody, this video of mine is regarding typhoid fever. This is caused by Salmonella typhi bacteria. Typhoid fever is rare in industrialized countries. However, it remains a serious health threat in the developing world, especially for the children. Typhoid fever spreads through contaminated food and water and through close contact with someone who is infected. Signs and symptoms usually include a high fever, headache, abdominal pain, and either constipation or diarrhea. Most people with typhoid fever feel better within a few days of starting antibiotic treatment, although a small number of them may die of complications. Vaccines against typhoid fever are available, but they are only partially effective. Vaccines usually are reserved for those who may be exposed to the disease or are traveling to areas where typhoid fever is common. Now let's discuss some of the symptoms. They are likely to develop gradually, often appearing 1 to 3 weeks after exposure to the disease. In early illness, once signs and symptoms do appear, you are likely to experience fever that starts low and increases daily, possibly reaching as high as 104.9 degrees Fahrenheit or 40.5 degrees centigrade. Then the next complaint usually is of headache, and thirdly there is a complaint of weakness and fatigue. Also, people complain of muscle aches, sweating, dry cough, loss of appetite and weight loss, abdominal pain, diarrhea, or it can be constipation. And there is a rash also. Sometimes people complain with extremely swollen abdomen. In later part of the illness, if you don't receive any treatment, you may become delirious, lie motionless and exhausted with your eyes half closed in what is known as the typhoid state. In addition, some life-threatening complications often develop at this time. In some people, signs and symptoms may return up to 2 weeks after the fever has subsided. My advice is to see a doctor immediately if you suspect you have typhoid fever. If you are from the United States and become ill while traveling in a foreign country, call the US consulate for a list of doctors. Better yet, find out in advance about medical care in the areas you will visit and carry a list of the names, addresses, and phone number of the recommended doctors. If you develop signs and symptoms after you return home, consider consulting a doctor who focuses on international travel medicine or infectious diseases. A specialist may be able to recognize and treat your illness more quickly than can a doctor who is not familiar with these areas. This is a very common problem because this typhoid fever is a common illness in developing countries. So sometimes what happens that if you come back to your country, for example, you are living in Europe, UK or USA, then if you develop signs and symptoms and you report to some doctor, maybe they don't recognize it. So it's better to consult those doctors who are familiar with infectious diseases and who know about the tropical medicine. So this is a really, because this has happened before. One of my relatives traveled to a developing country and she developed disease abroad. Then the doctor was unable to recognize the symptoms. Then I called that doctor, and then that she may be suffering from typhoid fever because she had a travel history. Then they did the test for her, and ultimately the diagnosis was of typhoid fever. Coming to the causes of typhoid fever, it is caused by virulent bacteria that is known as Salmonella typhi. This Salmonella typhi also causes some other problems which are related to gastrointestinal disturbance, and collectively we call them salmonellosis. But in this video I am discussing about the typhoid fever, which is another disease caused by Salmonella typhi. So you need to remember that salmonellosis caused by Salmonella it usually comes in the category of food poisoning, and typhoid fever are two separate illnesses. So, in this video I am discussing about the typhoid fever. Now let's come to the transmission. The transmission is through fecal oral route. The bacteria that cause typhoid fever spread through contaminated food or water, and occasionally through direct contact with someone who is infected. In developing nations, when typhoid fever is established, that's known as endemic, most cases result from contaminated drinking water and poor sanitation. The majority of people in industrialized countries pick up typhoid bacteria while traveling and spread to others through the fecal oral route. This means that Salmonella typhi is passed in the feces and sometimes in the urine of infected people. You can contract the infection if you eat food handled by someone with typhoid fever who has not washed carefully her hands after using the toilet. You can also become infected by drinking water contaminated with the bacteria. Now, it's also very important to know that there are some typhoid carriers. Even after treatment with antibiotics, a small number of people who recover from typhoid fever continue to harbor the bacteria in their intestinal tracts or gallbladders, often for weeks, months, or even years. These people, called chronic carriers, shed the bacteria in their feces and are capable of infecting others, although they no longer have signs or symptoms of the disease themselves. Now let's discuss some of the risk factors. The typhoid fever remains a serious worldwide threat, especially in the developing world, affecting an estimated 26 million people or more each year. The disease is established in India, Southeast Asia, Africa, South America, and many other areas. Worldwide, children are at greatest risk of getting the disease, although they generally have a milder symptom than adults. If you live in a country where typhoid fever is rare, you are at increased risk. If you work in or travel to areas where typhoid fever is established, if you work as a clinical microbiologist handling Salmonella typhi bacteria, if you have close contact with someone who is infected or he has recently been infected with typhoid fever, or you drink water contaminated by sewage that contains Salmonella typhi. Now let's discuss some of the complications. The most serious complication of the typhoid fever is intestinal bleeding or holes, that is also known as perforation in the intestine. These complications may develop in the third week of illness. A perforated intestine occurs when your small intestine or large bowel develops a hole, causing intestinal contents to leak into your abdominal cavity and triggering signs and symptoms such as severe abdominal pain, nausea, vomiting, and bloodstream infection, that is known as sepsis. This sepsis is a life-threatening complication that requires immediate medical care. Also, there are some less common complications. These include inflammation of the heart muscle, which is known as myocarditis, inflammation of the lining of the heart and valves, that we call endocarditis in medical terms, pneumonia, inflammation of the pancreas, that is known as pancreatitis, kidney or bladder infection and inflammation of the membranes, and fluids surrounding your brain and spinal cord, that is called meningitis. That's a very serious condition. Then there are psychiatric problems such as delirium, hallucination, and paranoid psychosis, which can also occur in typhoid fever. With prompt treatment, nearly all people in industrialized nations recover from typhoid fever. Without treatment, some people may not survive complication of the disease. Now let me tell you some preventive measures. In many developing nations, the public health goals that can help prevent and control typhoid fever, safe drinking water, improved sanitation, and adequate medical care may be difficult to achieve. For that reason, some experts believe that vaccinating high-risk population is the best way to control typhoid fever. A vaccine is recommended if you live in or you are traveling to areas where the risk of getting typhoid fever is high. There are two types of vaccine which are available. One is injected in a single dose at least 1 week before travel, and another vaccine is oral, which is given in the form of capsule. There are usually 4 capsules, with 1 capsule to be taken every other day. And you need to keep in mind that neither of these vaccines is 100% effective, and both require repeat immunization as vaccine effectiveness diminishes over time, because the vaccine won't provide complete protection. So you need to follow guidelines when traveling to high risk areas. So I am giving you some guidelines. Number 1 is wash your hands. Frequent hand washing in hot soapy water is the best way to control infection. Wash before eating or preparing food and after using the toilet. Carry on alcohol-based hand sanitizer for times when water is not available. Second is you should avoid drinking untreated water, because the contaminated drinking water is a particular problem areas where typhoid fever is endemic. For that reason, drink only bottled water or canned or bottled carbonated beverages. Carbonated bottled water is safer than uncarbonated bottled water is. Ask for drink without ice. Use bottled water to brush your teeth and try not to swallow water in the shower. Thirdly, you should avoid raw foods and vegetables, because raw produce may have been washed in unsafe water. Avoid fruits and vegetables that you can't peel, especially lettuce. To be absolutely safe, you may want to avoid raw foods entirely. Fourth is that you should choose hot foods. You must avoid foods that are stored or served at room temperature. Steaming hot foods are best, and although there is no guarantee that meals served at the finest restaurants are safe, it is best to avoid food from street vendors. It's most likely to be contaminated. Also, you must prevent infecting others. If you are recovering from typhoid fever, some of the measures can help keep others safe. For example, take your antibiotics, follow your doctor's instruction for taking your antibiotics, and be sure to finish the entire prescription. Wash your hands often. This is the single most important thing you can do to keep from spreading the infection to others. Use hot soapy water and scrub thoroughly for at least 30 seconds, especially before eating and after using the toilet. Number 3 is avoid handling food. Avoid preparing food for others until your doctor says you are no longer contagious. If you work in the food service industry or a healthcare facility, you won't be allowed to return to work until tests show that you are no longer shedding typhoid bacteria. And usually a doctor makes diagnosis based on medical and travel history. Your doctor is likely to suspect typhoid fever based on your symptom and your medical and travel history, but the diagnosis is usually confirmed by identifying Salmonella typhi in a culture of your blood or other body fluid or tissue. For the culture, a small sample of your blood, stool, urine or bone marrow is placed in a special medium that encourages the growth of bacteria. The culture is checked under a microscope for the presence of typhoid bacteria. A bone marrow culture often is the most sensitive test for Salmonella typhi. Although performing a culture test is the mainstay for diagnosis, in some instances other testing may be used to confirm a suspected typhoid fever infection, such as a test to detect antibodies to typhoid bacteria in your blood or a test that checks for typhoid DNA in your blood. Now let's come to the treatment. Although antibiotic therapy is the only effective treatment for typhoid fever, so it is recommended. The antibiotics are recommended, which I will tell you. First is ciprofloxacin, also known as Cipro. In the United States, doctors often prescribe this for non-pregnant adults. Another similar drug called ofloxacin also may be used, but unfortunately many Salmonella typhi bacteria are no longer susceptible to antibiotics of this type, particularly strains acquired in Southeast Asia. Second drug, which is can be drug of choice, this azithromycin, also this generic name is azithromycin. This may be used if a person is unable to take ciprofloxacin or bacteria is resistant to ciprofloxacin. Thirdly, there is an injection, which is a very effective treatment. That this injectable antibiotic known as ceftriaxone is an alternative in more complicated or serious infection, and for people who may not be candidates for ciprofloxacin, such as children. These drugs can cause side effects, and long-term use can lead to the development of antibiotic-resistant strains of bacteria. Also, along with this, you should remember that drinking fluid, which helps to prevent the dehydration that results from a prolonged fever and diarrhea. So you should keep yourself hydrated. So if you are severely dehydrated, you may need to receive fluid through a vein. For example, if there are serious cases, if they are hospitalized, then they may need IV drips. or if there is a perforation, like I told you before, that if there is perforation and it can lead to serious complication, for that surgery is needed.